Hi, teammates. Welcome to The Well, the Live Well podcast, the podcast that connects you to all the topics to meet you along your well-being journey. I'm one of your hosts, Jen Collins.
And I'm Seth Christopher. Welcome to The Well.
Hey, Seth. It is another edition of The Well. I am hungry, so if my stomach growls, I apologize up front. How are you today?
I'm great. I don't know why you're apologizing to me. You should apologize to our listeners who might be exposed to said grumbling.
I have not had lunch yet, so I am a little hungry, but I'm excited to dig into our topic today.
I am too. So we're going to talk about a little bit of a different spin on a topic we've discussed before. As in the month of August, this is Prevention Month. So we usually talk about all things prevention here at Live Well, but also across the health system in general, just because it's such an important topic, but there's so many nuances to it. So teammates, we're going to give you a little bit of a view into our world and how Live Well plugs into your preventive care and how we can help you to be your best you.
I love it. I bet you have some great fast facts. This is a topic is near to dear to both of our hearts, but the spin we're going to take is especially near to your heart. You really enjoy this topic we're about to discuss.
I do. So let's get into it. Fast fact. Many Americans don't have a primary care provider. In fact, according to a 2019 JAMA report, it's estimated that 25% of people don't have a primary care provider or a PCP. And interestingly, the percentage is higher among 30-year-olds, where 1 in 3 don't have a PCP. Fast fact, building a relationship with a PCP or primary care provider can lead to better overall satisfaction with your health. One study has shown individuals who engage in primary care are more likely to receive high-value care and be better satisfied with their healthcare experience than those who do not. Fast fact, for most Americans, the struggle of paying for healthcare is real. According to research from 2018, 61% of Americans say they have no money saved for healthcare expenses. And believe it or not, 64% of those that were surveyed in this study indicated they had avoided medical care in the last year because of expected costs. Now, Jen, a lot to cover, a lot to digest there. Let's say we sit here for a second and let's just dive deeper into the well.
Seth, your facts are really eye-opening and just kind of amazing. I know we're gonna dig in each fact one at a time, and I don't want to jump ahead, but you know the fact that the 30-year-olds that they were 1 in 3 didn't have a PCP. I'm actually surprised that it's that old. Like, I would have expected you to say 20-year-olds because they're transitioning from childhood to adulthood, and they going from their pediatrician to getting a, quote, adult doctor. But it surprises me because at 30, that means they've had at least 10 years maybe without a doctor, and they're well into adulthood.
Yeah, there's probably a lot of different confounds to look at when you look at these types of studies. I think broad stroke here is there's in the population, there's 1 out of 4 folks who don't have a PCP or relationship with a primary care provider that's a doctor or your advanced practitioners. If we are assuming these numbers are accurate, of course, I'd also say that there's probably some questions to the way that people are attributed to primary care visits or to having a primary care provider, because in our 20s and our 30s, it's really all about Band-Aids and boo-boos, right? Mm-hmm. It's about, I'm sick, I've got a cold, I've got an ear infection. Oh, and by the way, while I'm here, I'm getting my preventive visit that checks off the box for seeing a PCP. I think what we're really talking about is those folks who aren't getting engagement at all at any level for some of these additional primary care services that might be helpful.
That's a really great point, because I think about female care, and like you have to transition over to get your biannual check-ins with that particular physician. So it's just interesting to think about. But it also goes to your point of perception, right? if you have, are you seeing a PCP for Band-Aids and boo-boos, or do you know what's going on? Because if you're getting into your 30s and you don't have any type of relationship with a doctor, I would think you could be hit with some unexpected news and expenses, because chronic conditions can start to crop up in our 30s.
That's right. And some of those lifestyle habits that lead to chronic conditions and some of the genetic factors that play a big part of some of these things are also relevant at any age, but being aware of them earlier rather than later, or sooner rather than later, can make a huge difference in the outcome of your overall health and well-being, but also your long-term status and overall well-being.
Exactly. So if I'm a teammate and I don't have a PCP today, let's talk about some options to find a primary care.
Yeah, so there's a lot of great resources. I mean, for teammates, we have the luxury of being a part of one of the best health systems here in the South, if not the entire United States. Hashtag Atrium Proud. But we have access to our resources here at Atrium. We have a Atrium Health Value Network that is, a distinguished list of providers that are part of the Atrium Health family that are able to provide high-level quality services at a low cost. And so that's all part of, for those that are on the MedCost plan or the Live Well Health plan, whether it's just the HSA or the FSA, you got access to that network. And so there are a couple of places people can go to research and find those, Jen. Can you maybe give us a little more detail on that?
Absolutely. So if you are on the MedCost plan, that's a great place to go to find the Value Network. Go straight to the MedCost website. If you don't have a login information, you can log in right there, set that up, and you can actually filter through our Value Network, our preferred network. But you can go through and find that Value Network, which really does save dollars on your health expenses, which speaks to your third fact, actually.
Yeah, I mean, paying for healthcare it's a struggle. For a lot of us, it's not something we budget out weekly, monthly, yearly. If we're living in a Band-Aids and boo-boos kind of world, or we only go to the doctor when we have to, we're not really always planned or prepared for that. And so if you can take advantage of some of the resources that are offered through the Live Well Health plan, that being the different opportunities to engage with that Value Network, but also a lot of these preventive care services and getting that conversation going, those opportunities, those are all covered 100%. So you'll certainly want to make sure that you're validating what I'm saying versus your age and condition and diagnosis with your provider. But overall, there's an opportunity here to really save yourself financially on the front end at that experience and still get a high quality care experience.
And even if you're just going once a year for that physical, which is great, it's still an important idea to have a relationship with your primary care. I've talked to lots of young adults over my years, and they only go to the doctor when they're sick. This is not just young adults. Sometimes older adults do this too, but they only go to the doctor when they're sick, and then they don't know what doctor to go to. So they end up going to urgent care, or if it's after hours, they have to go to an emergency room. And when you talk about the expense of healthcare, that's huge, especially when you could use a virtual care situation. You can use an on-site care clinic. All of those, or go to a PCP, all of those are options that are going to cost you less than urgent care for something that a sinus infection, flu, UTI, those type of things.
That's right. Teammates, you got a lot of different options available to you. We certainly know that there are different variables in everyone's life that may impact their ability or their desire to develop a relationship with their primary care provider. We've got, Jen mentioned the on-site Live Well Cares locations that have the advanced practice practitioners that are able to provide that level of care, give you some recommendations, some referrals, build that relationship back if you already have an established primary care provider and you just want to take advantage of the super convenient, low cost access point to getting into those on-site locations. And then you also have on the front end too, thinking about the financial experience, as part of being on the Live Well Health plan. For those teammates that you get these Live Well contributions for fulfilling your incentives. And those are direct dollars that can be applied to your experience or to your costs of additional office visits, procedures, coverage with your plan members. These are all things that come back and play a big role in being prepared. That I think Atrium is doing a really good job of providing that support.
I'm glad you brought up the HSA and the FSA and talking about the money that Atrium is giving through our incentive program. Just one thing I wanted to add, because you're talking about expenses right now. So I'm just thinking about those teammates who may be leaving money on the table because they don't have any expenses for medical expenses. Save for a rainy medical day, or save for retirement, for your medical expenses for retirement. So it doesn't have to be something you're going to use right now. You can grab that money, put it in the HSA, and save it for later down the road. A lot of times that's what you would want to do, because your fact talks about most Americans that struggle to pay for healthcare because they're not saving. So, we've done a lot of great financial conversations with Cindy. This is another one here, just saving for that medical expenses.
And there are resources that are available to, when I think about it, I know 20s, probably most of us in our 20s, we weren't thinking about how we're going to pay for our healthcare in 30s and our 30s and our 40s. Being on the other side of my 30s now, it's a little bit more of a real thought process for me. I certainly would have fallen in personally into that 1 in 3. I don't know. It's not that I didn't take it serious, but I had other priorities in life. And I'm sure teammates are out there thinking, look, I don't have time to just make a random appointment unless I need to. I've got priorities with family, with work. I'd also say, with that perspective, maybe zooming out and just saying, hey, what's important in the long term? And sometimes once you ask yourself that question, it makes it easier to start to make these investments in yourself and your own health and well-being. And, we talked about it a while back, putting your oxygen mask on first and making sure that you've prioritized your health. And whether that's through the Live Well programs, or our conversation today is engaging in developing a relationship with a primary care provider, we know that PCPs are just invaluable members of your care team that can help you detect, manage, and prevent various health issues. So, and they can also provide lifestyle tips, help you with the medications, and then give you those additional screenings to help make sure that you're your best you, not today, but your best you 10 years from now, 20 years from now.
Well said. We talked about the MedCost website as a place to find a value network. Do we have this additional information, the HSA contributions, the incentives? Where can teammates find some of this other information we've talked about, including the on-site care clinic locations?
So all this information is posted out there on People Connect. And I say out there, it's like up there in the cloud in front of you if you're on your computer most of the day. But you can locate this on the LiveWell site. We have some links, direct links to a lot of this information. There's also a teammate site that you can get access to this too. We'll post both of those direct links in the show notes today as well.
We have talked about so much great stuff today. Hopefully, we're able to resonate with teammates and provide some really great information and pushes to get, there's still time for the incentive especially. So we have one more deadline if you need to get that annual physical done, or find a PCP. We have one more deadline in October that you can still earn these incentive dollars.
And Jen, how I can tell that we here at the Well and as part of Live Well have our teammates prioritized first. Our topic today, we didn't even talk about until now that you can get incentive dollars for having that annual visit and registering that in the Total Health Portal. That's kind of a byproduct of it all, but you can get credit for it. So you get rewarded and you get paid, put in your HSA or your FSA account to have that visit.
Absolutely.
So Jen, a lot to uncover. This is a really good conversation. I love the angle on trying to better manage your health and kind of counterbalancing that with the financial aspect of it too. Important to develop a relationship with a primary care provider, but there are a lot of other good points that come out of today's conversation. What exactly did we learn today?
Well, we learned that about 25% of people don't have a PCP, and of those that are in the age of 30, according to this study that you provided, 1 in 3 don't have a PCP. If you do not have that established relationship, you could get hit with a surprise medical bill because you're not getting those annual or biannual screenings. Also, having a place to go when you're sick can be cheaper, especially if you are having to go to an urgent care or ER because you don't have a physician's office that you can call. Using the Atrium Health, the Live Well Care clinics can be very cost effective and very convenient way to get established primary care. And teammates, if you're interested in hearing more about that, we did a podcast last August that had a guest, Dr. Cosenza, there. So check that one out in our streams channel if you want to hear more specifically about the Live Well Care clinics.
And just rounding out today's conversation, Jen, and with this 20 to 30-year-old conversation, 40, 50, 60, 70, 80, whatever your age is, sometimes getting off work and going to the primary care provider, going to your doctor isn't convenient. We've got those on-site locations. We also have virtual visits. And I know this is something that's real top of mind over the last year. We've had it for quite some time, but most primary care provider offices will have access to a virtual visit. If you're going through the My Atrium, there's a virtual visit option. You can also go through the Live Well Care clinics or the on-site care locations and pull up the option for a virtual first visit. These are all important because they're convenient. So if you fall into that 20 and 30-year-old bracket, guess what? You could just easily click on a button, which is what most of us like to do anyway these days, but there are options out there to meet you where you are. And we're going to do our best to keep providing this information because we know it's important and we know that it's going to help you to be your best you.
On our next podcast, we will be talking with Cindy about preventing financial scams. This show will be airing August 12th, and this topic sounds so ominous. I can't wait to break this down with Cindy.
That's right. Very ominous, but teammates, we're going to have to wait a little bit. But while you're doing that, just don't forget today's conversation. Please visit the Live Well website for more info on managing stress, information on your HSA and FSA accounts. Don't forget to visit the MedCall site. And of course, don't forget to stop by the teammate site and visit the Well page right there on the left.
Our resources are listed at the end of the show, and we'll add links to the programs discussed today in the comments on our streams channel.
Looking for more things Live Well? Not following our streams channel yet? Search The Well on streams in Office 365 or find us on the Live Well website to access all our content.
Thanks for listening to The Well today.
Stay safe
and live well.